Butter and margarine are widely consumed products around the world, each with its own characteristics and health impacts. Butter, a milk-derived product, has been used for thousands of years, while margarine was developed in the 19th century as an economical alternative to butter, especially during periods when there was a shortage of raw materials, since its creation context is directly linked to the military. These two products have been the subject of more detailed studies due to the difference in their nutritional compositions and their effects on health, which has generated a broad scientific and public debate over the decades. The main difference between butter and margarine is in their fatty acid composition. Butter is rich in saturated fats with an average of 49.5%, while margarine, especially in its initial form, contained large amounts of trans fats resulting from the partial hydrogenation process of the vegetable oils used for its production. This process was widely adopted by the industry to increase product stability and shelf life, but has subsequently been associated with several health risks, including cardiovascular disease. Growing concern about trans fats, substances derived from the hydrogenation process used in the manufacture of products such as margarine, has led to a series of adjustments. The decision by the Food and Drug Administration to exclude partially hydrogenated oils in 2020 was motivated by the risks associated with the consumption of trans fats, such as an increase in cardiovascular disease and other health problems such as elevated LDL cholesterol and reduced HDL cholesterol. This measure aims to reduce the incidence of cardiovascular disease, since trans fats are linked to an increase in LDL cholesterol levels and increased inflammation. This change reflects a global trend towards improving processed foods, aiming to minimize the risks associated with the consumption of trans fats and promote a healthier lifestyle. In addition to regulatory changes, the development of new technological processes has allowed the creation of margarines with different fatty acid profiles and sensory characteristics. For example, margarines that do not undergo the hydrogenation process and are enriched with some type of micronutrient, the most common being vitamins A and D. This was proposed as an innovative alternative offering a differentiated nutritional profile, since its composition presents lower values of saturated fats in relation to butter, and still has these additions depending on the needs of each individual. This type of innovation demonstrates the continuous effort of the food industry to respond to the demands for healthier and more sustainable products, with the potential to minimize the environmental impact associated with the production of traditional vegetable fats. At the same time, butter has also undergone transformations, with the introduction of functional varieties, such as the previously mentioned micronutrients that aim to benefit health, which seek to offer additional health benefits, such as reducing the risk of cardiovascular diseases and improving the lipid profile of consumers. These products combine the traditional characteristics of butter with ingredients that aim to improve health, such as phytosterols and omega-3 fatty acids. In terms of culinary applicability, both butter and margarine have different physical properties that make them more suitable for certain preparations. Butter, for example, is preferred for its flavor and ability to impart a creamy, smooth texture to baked goods, while margarine is often chosen for its spreadability and the possibility of manipulating its physical properties, such as consistency and melting point, through adjustments in the formulation. Therefore, the present study aimed to review the available literature on butter and margarine, focusing on their processing and health impacts. In addition, the comparison between the products allows a comprehensive analysis of the advantages and disadvantages of each, offering important subsidies for informed decisions about the consumption of these foods. The history of butter dates back thousands of years, being one of the first processed foods used by humans. Initially produced in small quantities from raw milk, Butter was considered a valuable product and used both in food and in religious and medicinal practices. The traditional production process involved churning milk or cream to separate the fat from the whey, a method that remained virtually unchanged for centuries. Over time, butter production became industrialized, especially from the 19th century onwards, when the development of new technologies allowed production on a larger scale. Butter became a staple food in many cultures, being appreciated for its unique flavor and texture, as well as its nutritional value, which includes a high concentration of saturated fats and fat-soluble vitamins such as A and D. On the other hand, margarine was developed as an economical alternative to butter during the 19th century. Its creation was motivated by the need to find a cheaper substitute for butter, especially during times of scarcity. Initially, margarine was produced from animal fat, but with the advancement of hydrogenation techniques in the early 20th century, vegetable oils began to be used, resulting in a more stable product with a longer shelf life. The introduction of partially hydrogenated oils in margarine production brought with it the issue of trans fats. Trans fat is a type of unsaturated fatty acid that results mainly from the hydrogenation process, where liquid vegetable oils are converted into solid fats. This process is widely used in the food industry to improve the texture and increase the shelf life of products such as margarines and foods. The evolution of margarines continued throughout the 20th century, with the introduction of fortified products and the adaptation of production processes to meet consumer demands for healthier and more sustainable products. Recently, margarines have started to incorporate ingredients such as phytosterols, which help to reduce blood cholesterol levels, and other additives that aim to improve the nutritional profile of the product. Phytosterols are plant compounds that have a chemical structure similar to cholesterol, found in small amounts in a variety of plant-based foods such as oils, nuts, seeds, and legumes. They are known for their hypocholesterolemic properties, as they compete with cholesterol for intestinal absorption, thus reducing LDL-C or low-density lipoprotein levels in the blood. The history of butter and margarine is marked by continuous technological evolution and changes in consumer preferences and needs. Despite their different origins and compositions, both products continue to play important roles in the modern diet, with debates surrounding their nutritional qualities and health impacts. The creation of butter dates back approximately 4,000 years, with the beginning of the domestication of animals. It arose accidentally, since when using domesticated animals for transport, it's possible that the milk that was in containers, with the agitation of long journeys, resulted in the separation of the fat from the liquid. Butter has a lipid profile composed mainly of saturated fatty acids, which represent around 65 to 70% of its total fat. The main ones are palmitic acid, stearic acid, and butyric acid, which is characteristic of dairy products. These fatty acids give butter a solid texture at room temperature, but they're also related to increased levels of LDL cholesterol in the blood. This is one of the main subjects of discussion regarding this product, since high consumption of these elements is not desirable for people in general, especially when associated with some type of disease. The remainder, equivalent to approximately 25% of the lipid composition of butter, is formed by monounsaturated fatty acids, mainly oleic acid, which has potentially beneficial effects on cardiovascular health, such as reducing inflammation, improving the lipid profile with increased HDL-C and decreased oxidized LDL-C, in addition to reducing inflammatory markers such as C-reactive protein and inflammatory cytokines, which contributes to the prevention of cardiovascular diseases. There are also small amounts of polyunsaturated fatty acids, such as linoleic acid, which are essential for human metabolism. Despite the majority presence of saturated fats, butter is also a source of fat-soluble vitamins, such as vitamins A and D, which adds nutritional value to the product. The first formulation of margarine used animal fat, mainly tallow, mixed with other ingredients, and over time the incorporation of vegetable oils and the hydrogenation process were significant innovations that improved the stability and texture of the product. The butter production process involves churning cream, which can be obtained from raw or pasteurized milk. This process results in the separation of fat from whey, forming an emulsion that is subsequently molded and refrigerated to form butter. Pasteurizing milk before butter production is a common practice to ensure the microbiological safety of the product, but it can also influence the final flavor and texture. Over the years, butter production has undergone several technological innovations. The introduction of automatic churning machines and centrifugation techniques into the industry has allowed for increased efficiency and scale of production. In addition, temperature control during the churning process has made it possible to produce butters with different textures and sensory profiles, suitable for different culinary applications. On the other hand, margarine production involves a more complex process which includes the emulsification of vegetable oils with water or milk, followed by the addition of emulsifiers, colorants, preservatives, and vitamins. The hydrogenation process, which was used in the past to solidify vegetable oils, generated trans fats, but today this method has been largely replaced by alternatives that avoid the formation of these harmful fats. One of the main innovations in margarine production in recent years has been the introduction of oleogels, which are structured gels of liquid oils. These oleogels allow the creation of margarines with a high content of unsaturated fatty acids, which are healthier and can also be enriched with antioxidants such as vitamin C, to improve the oxidative stability of the product. Another important aspect of margarine production is sustainability. The search for alternative sources of lipids, such as the use of olive oil residues, has gained prominence as part of efforts to reduce the environmental impact of the production of edible fats. These alternatives not only seek to improve the sustainability of margarine production, but also present new challenges and opportunities in terms of nutritional quality and consumer acceptance. Both butter and margarine have distinct health impacts, influenced by their fatty acid composition, the origin of the ingredients and production methods. While butter continues to be valued for its sensory properties, its implications for cardiovascular health are a cause for concern. On the other hand, modern margarines with healthier fatty acid profiles represent a safer option for cardiovascular health, although they continue to face challenges in public acceptance.